Hello and good evening. Welcome to another episode of Healthy Vision on the PCVI Network. I'm your host, Lady Nay, for the evening, and it has been my pleasure to be on the show and to present several bits and pieces of information on eye care, vision care, and also share conversations with our Chief of Staff, Dr. Prince. So we've been focusing on a lot of wonderful things that are concentrated on in the month of November. I'm going to give you this chance to go take a pen and paper. You might want to write down what you hear tonight, or you may be able to share information with somebody else that you know. All right? So thank you so much for being with us. Thank you for watching this show. Stay tuned. We'll be right back with much more information on healthy vision. I'll see you in...
Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous café sa famille. Oui, nous café sa amis. Oui, nous café sa famille. Oui, nous café ça.
C'est glauque comme fait manger. Ou ka tete?
Oui, nous café sa famille. Oui, nous café ça. Nous café ouais.
Cataracte fait pas ka ouais ko sou ka tete?
Nous café ça.
Depuis cycle la prend pas ouais ménager comme si pourtant tension j'aime toujours à monter descendre.
Café ça.
Nous capable pas gros côté coopération ouais qu'on y a là ou posséder depuis la peau
Oui, nous café
reste
ça.
dans tout poser la journée moi depuis l'angélisme pas rien pour arrêter
Café ça. Nous café ouais.
depuis au monde devant moi mosso pas un mosso
Café ça.
comme si tout bon nous arrêter
Nous café ouais.
eh ben nous même ça nous ici
Nous café ça.
c'est vrai.
Nous café ouais.
Bon, ça nous y est depuis me venir là, ma point.
Téléphone nan c'est 516 230.
And we're back on Healthy Vision. Thanks for being with us and welcome, Dr. Prince. Welcome to the show. How are you feeling tonight?
Everything is well, and we say good morning, good evening to everyone who are watching to us tonight.
Now, the last episode when we got together, we kind of did an introduction to the month of November, and we talked about a lot of things that are concentrated on in terms of the healthcare field in November. But do you know that we didn't even get to everything that November focuses on?
Yes, because November is a lot of things. We always said that to a lot of people watching the show because there is a lot of research, there is a lot of organization in this country. All these organizations, a lot of university, they are doing their work. They try to keep people healthy. That's why you have so many things. I may not be surprised if we didn't get to anything. What else we have to take? Me, I only focus on, I know November is diabetic eye disease.
Yes. And we're going to get into that. But let's give the people just a little taste of things that they can learn about and things that they can gain awareness of in November. So November is Lung Cancer Awareness Month also, all right? So we talked about COPD last episode, and that's a breathing related disease, but so is lung cancer. There's also the Great American Smokeout, which to me, it's about helping people with what you mentioned, quitting smoking, right? So COPD, lung cancer, smoking cessation, all those things are focused on in November. There's also Prematurity Awareness Month. You know, there are babies that are born before their time and they come out as preemies. The other day I spoke to a woman and she had her child with her, and she said, you know, this child was a preemie. She said when he was born, he was, you know, so many ounces and not even a pound. So I was very happy to learn that that child had made it through the premature months and made it to a full healthy childhood. And that child was running around everywhere, being a healthy, normal child. So if you are a parent of a premature child, you know, you can do research and you actually can be a source of knowledge for someone who is going through that right now in the month of November, or actually throughout the whole year, right? What would you agree?
Well, what I'm taking, November is a lot of time, you know, and I know it's a lung cancer month. And when we talk about smoking, you know, if you know anyone, I'm always in the side to give advice. If you know you're going to get pregnant, and throughout, or if you're pregnant, I will advise you to try to quit smoking, because if you love your kids to be healthy, you know, throughout the pregnancy, it will be best for you. As your OBGYN will advise you to advise to quit smoking is the best thing to do. Now, me, I'm most likely, because it's a healthy vision show, now, I will most likely, because if you don't quit smoking, there is different complication you can have. The complications, and when a kid is in distress, when the kid is suffer inside the mother, or is a premature kid, anything can happen. The vision can be affected. You know, and a lot of things can happen. Now, I know a lot of people, even it's not October months, you know, would love us to talk about those kids that inside the mother that's completely blind. I have one of people that asked me, you see, I'm jumping from different subject, because as you're talking about kids, I'm talking about one of the patients that was asking me, all these, and about these kids that doesn't see, or when the kids inside the mom, they don't know outside the world, or they be able to communicate with their mom, you know, stuff like that. When I always explain to them, the mom communicate with the kids. They know when the kid is moving. The kid is listening to the voice of the mom all the time. You know, the bonding aspect, all these situations happen inside the mother's side when the kid, even if the kid doesn't, when the kid's born without seeing, without vision, because, you know, we learn by imitation, because if we have both of your vision, the kid that doesn't have it, you know, the mom has to have some form of vocabulary, stuff like that. You know, I'm just trying to answer a question for one of my patients as you give me that opportunity when you talk about kids. And just to answer you, you did ask me, all the kids will be able to communicate with their mom if they completely blind, or the kid be able to survive? Yes, they have some form of communication between each other. The mom has some form of vocabulary throughout the whole time where they educate the kids, you know, stuff like that. That's, now, if you have your kids, you have your parents that have a kid that's completely blind, the first thing you have to do is try to get early intervention in the first place. Get some professional that can help you and throughout the process, you know, stuff like that. I know I go outside from your stuff, because I'm trying to be right with the PDG that looking at me, that want us to stay in vision.
Well, definitely. You know, I think, you know, all of these things have to do with healthy vision. You mentioned your patient that asked about children who were born with no vision, completely blind. That reminds me of a movie I was watching about Ray Charles, the famous musician, the famous singer and pianist. And I was watching the story of his life, and from the time he was a little child, his mother said, you know what, even though you cannot see, I still expect you to function. I still expect you to live in this world, because no one is going to try to, you know, give you a pass, or I don't want you to live life as a handicapped person. So his mother didn't baby him and didn't stop him from having experiences. As a matter of fact, she gave him tools. She said, okay, walk, you know, feel the wall, you know, try to listen, use your other senses to help you get around in this world. And a large part of his success was because of the high standard that his mother had. So those that do have children that have shortcomings, that may be premature, I know that, you know, your first instinct is to, oh, you know, baby that child or accommodate that child and give that child a lot of love and nurture. Yes, the child does need a lot of love and nurture, but the child also should feel empowered and capable of doing things to get along in this world. So I think that that's
No,
a
I
good
guess
point.
you did a lot of research, and which is very good. You know, stuff like that, and because you take a lot of information from what you said. You take the bonding aspect between child and parent, stuff like that. Because as we know, the first 2 years is the best time where you can keep put the child in the right path. You know, during that time, this is the time the child really need their parents, stuff like that. Now, we talk about the people that's completely blind, or people that have child that's completely doesn't have the vision. They have to have some form of communication with the child. You know, and now if you don't know how to do that, don't get scared. Look for help. Don't try to just leave the child somewhere and just try to take care of for yourself. There is professional that can help you. You know, hopefully this month, every month is something. This month, I know is this is diabetic month, but if you call any state agency, they will be able to help you
Yes,
and
because
guide you to the right. Yes.
it's also Family Caregiver Month, Awareness Month. And if you have someone or a child especially that has low or no vision, you are a family caregiver. So all of these things are connected to the month of November. They're all connected in some type of way or another. Well, you know, we just got the signal that it's time for us to take a break. So we're going to take a break and we'll be right back. Stay tuned. We'll be right back.
Prince Center for the Visually Impaired is a state-of-the-art facility with low vision specialists for all your vision needs. Our low vision rehabilitation specialists will accurately measure your visual capabilities and help you use it more efficiently. Please call us today for a low vision evaluation at area code 516-200-3850 or stop by our local office located at 550 West Merrick Road, Suite 3, Valley Stream, New York, 11580. Do not assume your options are limited to surgery or glasses, and do not wait until you are legally blind to benefit from our services.
I have some news to share with you. I have some news.
That's good.
So, you know, a lot of people, you know, they try to take care of their health, their vision, their body, you know, exercise and things like that. And they take vitamins. They take a lot of over-the-counter vitamins and supplements. And they feel like, oh, well, since this is something good, you know, I guess I can have as much as I want. So what has happened to some people is that they've taken niacin, which is a very important vitamin. It's like a form of B3. It's also known as vitamin B3, niacin. And they feel like, okay, this is something good for me, but they don't regulate the dosage that they take. And it's been shown that there are some negative impacts on their vision, okay? So there's kind of like a toxic buildup in their body of niacin, and that reaction is called niacin-induced cystoid. And it's not a good thing. So when these people go to the hospital or they go to the emergency room, they are complaining that their vision is altered and they can't really see that well. And they're instructed, you know, to like pull back on this thing that they're taking, the niacin, because it's too much, you know? What do you think about that?
Okay, yeah. Well, that's, there is a lot of research. I believe I did read about this article, most likely by some of the ophthalmologists in the city, in New York City. And because niacin, as you said, is a form of vitamin, is a form of vitamin B3,
Yes.
and it's good for cholesterol. A lot of people, and some people can get it over the counter. Even if you look at it online, as some of my classmates called in Dr. Google, you will see they say to you, they give you a lot of dosage, a lot of stuff, and that's why a lot of people think they can go, as soon as they saw medicine over the counter, they can go get it, and without think about the dosage, stuff like that. Niacin is a good medicine. It's good for cholesterol, and right now there is a lot of research going on by some of the university, most likely from Hopkins University. They're doing research on but not in the form of niacin, in the nicotinamide. It's a form with nicotinamide, it's still a form of vitamin B3. Now, the research already show people that take that can help reduce the high pressure also. That means there is bad effect, there is side effect. Now, these people, as you said, these are the people that go over the counter, and even the doctor used to prescribe the niacin. They think because they can see it over the counter, they can buy it without a prescription. They just go and get it and get too much. They don't know that. And when they get too much, it's getting toxic, and it affects some of the cell in the back of the eye, in the retina, and that's called the Mueller cell. And for some of the doctor, a lot of physician or the nurse, a nurse practitioner, they may know what the Mueller cell are. These are the super cell inside the eye that hold some of the structure inside the eye. What the niacin does, the overdose is affect those cells. And now liquid start going to the macula. That's why this person that have 20/20 vision, and this person see completely blurry. Now, a lot of people, thanks God for this person, because some other people will go some facility, they will start doing a injection and doing a lot of things.
And those are not necessary.
Yes, but this person was lucky. He was seen by some of the top ophthalmologists in Mount Sinai, and that's why they be able to get some demographic information from this person. As for where you live, family history, what medication are you taking. This person being said, I have high blood pressure and high cholesterol, and with medicine you've been taking, and the person give not only the person not only take medicine for cholesterol, the person add the niacin because the person think that can prevent her have heart attack, prevent him get heart attack. Yes, but even if the niacin will help that, they don't know the correct dosage. This is where the person get extra niacin and get it, the person and
They got a toxic reaction.
And now this person was able to be rehab in less than 3 days because they just stopped the person from the medicine, and the vision get back straight
to 20/20.
20/20. That was but we don't want anyone watching the show PCVI Network to get to this, because we know a lot of us may have high blood pressure, a lot of us may have cholesterol, a lot of us doesn't have insurance. There are a lot of us try to get coupon from Walgreens or from CVS, try to get our medicine. And now a lot of us, if you look, we'll go over the counter and get omega-3, and we will see niacin, you will see some of the medicine over the counter. A lot of us will buy, but it's not the proper thing to do. It may work for some people. It's always to get a professional advice. Get in touch with your doctor. Ask your doctor the right dosage. Even if you see it, call your doctor, say, I see this dose, and I don't have insurance, can I buy it? If that's going to work for me, is that the correct dose for me? It's always good for you to check your professional, because this is what we're doing. We're going to get this type of news, and it's a good news you give, but the same B3 vitamin you're talking about, they are working on it, because if this research come true, it will be a big help for a lot of people who have glaucoma. Because because the reason they're doing it, because because there is a lot of money for a lot of those organizations that do research. Because what they found out, so much money is spending for eye job for glaucoma, for surgery for glaucoma, and sometimes it's not even taking care of the issue. And that's why they found out if that can work, that would be a big help, for the patient, for the pocket. Maybe not be a big help for the ophthalmologist, but it would be a very good thing for the patient, for the safety of the patient, stuff like that. That's a very good news you give. Hopefully, a lot of people who watch this show, this information is very valid information, because this way, because we may have these people come to, if these people come to the brain center, most likely we will see the edema in the back of the retina. But we will have to refer that person to a retinal specialist.
Okay.
So
one word I think that we really need to keep in mind as we talk about vitamins and supplements and things that are good for you and things that are good but then they can turn bad, we need to think about the word homeostasis, right? Which is balance in the body. So, water is good for the body, but too much water is bad for the body. Niacin is good, but too much niacin will give you a toxic cystis, Let me get that
but I
word
know you tried
again.
to get the medical word.
Niacin-induced cystoid. That is the exact word. So all these things that happen, we have to stay within balance. Just like people who have iron deficiency, if they take too much iron, then you can actually have iron poisoning in your blood. And there are also other vitamins that you need to take with the iron so that your body can absorb that iron in your body. You can't just take it in isolation. So we do need to think about balance, homeostasis, taking the right dosage, not taking too little, not taking too much. It's very important.
Yes, and the best way to do it, don't try to treat yourself.
Okay.
I know right now, a lot of people think they can go to Google and take care of themselves and do things on their own. No. And there's a reason the doctors, they spend that much here in school. You understand? Check with your primary doctor. Check with your nurse practitioner. Whoever is your doctor, make sure, you talk to them. As far you can always get it, but it's best to have good relationship with your primary care.
Definitely. So with that being said, we're going to take a short break. That was it for the news. And we'll come right back. So stay tuned with us and come back to Healthy Vision on the PCVI network.
Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous café sans famille. Oui, nous café sans amis. Oui, nous café sans famille. Oui, nous café sans.
C'est glauque comme fait nager. Ou ka tete?
Oui, nous café sans famille. Oui, nous café sans. Nous café ouais.
Cataracte fait pas ka ouais ou sou ka tete?
Nous café ça.
Depuis cycle la prend, m'pa ouais bien nager comme si ou tout. Tension j'aime toujours à monter descendre.
Café ça.
Nous capable? Pas gros côté opération ouais. Qu'on y a là ou possède depuis vin la bon.
Oui, nous café
Reste
ça.
dans tout posé. La journée mouais. Depuis l'angéliste pas rien. Ou ka tete?
Café ça. Nous café ouais.
Depuis au monde devant moi mosso pas un mosso.
Café ça.
Comme si tout bon nous ka tete?
Nous café ouais.
Eh ben nous même ça nous ici.
Nous café ça.
C'est vrai?
Nous café ouais.
Bon ça nous y est depuis m'vini là. Ma point?
Téléphone nan c'est 516 238 50.
And we're back on PCVI, and this is Healthy Vision. I'm your host, Lady Nay, and I'm here with Dr. Prince. And Dr. Prince, we've been talking about a lot of good information. We talked about some of the things that we concentrate on in the month of November, and we just heard some news about vitamin B3, also known as niacin, and the importance of speaking to your health care professional, speaking to your doctor, your primary care doctor, about supplements, vitamins, how much you should take, and how much is too much. We want to be within balance. Now we're going to change over to another story now. I was reading about this young man that's called Kirk Adams, a young man named Kirk Adams, and
You're talking about
is he,
the CEO of American Foundation for the Blind? Is that what you're talking about?
that's what I'm talking about.
Oh, okay. You're talking about the story or the reality? It's not about story.
No, no. But it's not a story, but he tells his story
Okay.
about how, he had so many challenges in his life as a blind person, because he said that he was 5 years old when he lost his vision, and things were very hard for him. And when he was growing up, there were no laws and there was nothing on the books that said that he was guaranteed an education or that things would be provided for him so that he can learn as a blind person. So you also know some of his story too, right?
Yes, I do know a lot because being a low vision rehab specialist, and we have to learn a lot about the story of the people that allow this field to give us the opportunity to talk about it, that inspire us, because no one in the low vision or blind rehab field doesn't know about Ellen Keller, doesn't know about Anne Sullivan, because these are the people that make this field, and we they are. The same thing you talk about Adam Kirk, but his story, like you said, what he did lose his vision early, but he did auditions to go to school. Now, he did auditions to go to school. A lot of people that what Joshua may see, well, where we come in with talking about that, about the CEO of American Foundation for the Blind, well, this is a way to show everyone you can be whatever you want if you want to, and to let everyone watching, if you have the opportunity to have both of your eye, that doesn't mean you are better than someone that doesn't have the vision, because
or more capable.
yes, because me, I one of my best friend and classmate, she was completely blind. She is completely blind. You understand? And she take the same exam like me. Sometime, and maybe one day I'm going to try to see if I can contact her and see if she can be guest on our show. And she's a smart person. You understand?
Well, yeah.
And she can do whatever I do. She can do it. She take the same exam. Sometimes she has better score than me.
Well, yeah, because maybe she has less distractions around her. Maybe, when you're deficient in one skill or in one sense, you're stronger in another way. So in Adam Kirk's situation, Kirk Adams, in his situation, he says that he did very well academically, and he said that he graduated Phi Beta Kappa with his bachelor's degree in economics. So, he didn't even, the thing that is really interesting about his story, his situation, is that when he graduated, he wasn't even focusing on blindness or vision impairment. His focus was on economics, but he found it hard to get employment in that field.
Yes, and even the screening process with some of the school, some of the profession, when they ask for information as for your vision, is a little tough. Now, I would say to you there is a lot of improvement, and we will continue to fight. When I said we continue to fight, because we in the fight, you understand? Because this year I see a lot of improvement compared to the past 2 years, because I've been received a lot of kids from the National Community College. They send them to the Press Center for us to evaluate them and advise them the best way, they can be succeeding in school. And I was shocked. As for some option they give me, they provide CCTV, they provide some expensive stuff. I said, sure, that's good. Because these things didn't happen before, because we have one of the kids that have what they call retinitis pigmentosa, but she went there because her parents didn't know. When she went there, the kids fell. The kid failed the entrance class because there is something called the passing behavior. Maybe one day we can talk about this, where a lot of parents, a lot of people that lost their vision, not the one like that completely blind, they don't want to let people know they don't see. They don't want you to label them. This is what happened with this kid that have retinitis pigmentosa. She doesn't see well, or her parent in her mind, she think if she said that to the school, the kids will not have a chance. And guess what? The kids take the first entrance exam, the kids fail.
Yeah.
And now the parent was crazy, stuff like that. And I said when the parent was explaining, I said, let her come here. I said, did you let her take the same exam like the other people came? I said to her, she said to me, yeah. I said, of course she's going to fail. Because she doesn't see well. And I said, let me help you. Let me write a letter for you, stuff like that. And she was shocked. And we did that for her. And the school was so happy to give her the opportunity. Because this is law. There is a lot of improvement being doing. I'm saying we still have a long way to go. Now, and on the time with Adam, he went to school, he was able to go to school, he graduated, but he could not find a job. Because anytime he said, even said that when he go with the can, they already think they're not going to hire him. Because this is all ignorance. Because they don't know, what he's capable of doing.
So they saw him, they saw his disability, and they already came to a conclusion, this person would not fit here. But now, the law that you mentioned about is actually an act. It's the Individual with Disabilities Education Act. And so that ensures and it guarantees that people who have disabilities or shortcomings, that they will be accommodated and things will be provided for them so that they can show what they know based on their intellect, not based on their disability.
Yes, that's why it is. And that's a good thing, this act, but this is one of them. We will still continue to fight. There is a lot of more, for a lot of people, we have vision loss and to be doing. But as you said, with Adam, his story is an inspired story because he didn't stop from here. Because I heard that too, even for my classmate also, because when she graduated, and I know she was looking for jobs, but it looked like it was a little hard for her to get the job. I don't know. I've been not speaking to her for a while. I don't know if she's found the jobs, because this is all ignorance. Because these people are the smartest people. Because the only thing I may understand, some of the job don't have the economic power to do that adaptation. But if you want help, there is state agency. If you want help, there is sponsor. And there is organization that can guide you where you can go to get help for these people. Because did you know there is what in New York State there is what they call vocational rehabilitation department, that have counselor that can look for job for these people?
Yes, because from what I'm understanding from the article, 7 out of 10 people are able to work, but they are not hired. So that is a big 70%.
Yeah.
We're going to get into that in just a little bit. We need to take a break, but we need to continue this conversation.
We do need it, because we're going to have ask for the PDG to give us more time, because this is what the network is about.
Yes,
that's a very important topic.
So we'll be right back. Stay with us.
Center for the Visually Impaired, c'est une facilité qui a toute qualité vision réhab spécialiste qui peut résoudre problème vision. Arrêtez de attendre jusqu'à ce que vous veniez perdre vision pour bénéficier de services non. Pas assumer que celle ça qui peut résoudre problème vision, c'est opération ou du moins glasses. Si journée jeudi il y a une activité ou te qu'on fait avec facilité ou pas capable encore, quel que soit notre travail ou quel que soit la caillou, si que notre travail ou une activité ou te qu'on fait non 20 minutes qu'on a besoin 40 minutes pour faire ou du moins si tu as un petit monde qui l'école qui te qu'on fait travailler bien qui nous fait tout bagage bien pas le temps c'est là que l'école et vous le tourner pour la loi docteur Zueli viens pour une consultation dans Prince Center for the Visually Impaired nous localisés dans 550 West Merrick Road Valley Stream New York 11580 et téléphone nous c'est 516 238 50.
So we're going to continue our conversation that we were having about Mr. Kirk Adams, who is the CEO of the American Foundation for the Blind. His story is very inspiring to me, you know, because he talks about all the challenges that he had as someone who was a young man of working age, but for many, many years he could not get a job anywhere because whenever people saw him, they already concluded, oh, he can't see, so therefore he can't work. And that actually was not true because he had very good grades in school. He graduated almost at the top of his class, and he was doing very well. He was very intelligent, but he still couldn't find any work. So, you know, in his situation, he said that he decided to change his approach. Instead of people finding out that he was blind when he went on the interview, he said, you know what, let him put it on his resume. So he started to write it on his resume that he was blind since the age of 5. So that way, when people were looking for, you know, candidates, employees, he wanted them to know from the beginning that yes, he had this situation, but yes, he also could work. What do you think about that?
Well, the story of Adam is a good story. It's an inspired story, like you said, and the reason we use that story from the show, just to educate everyone. You know, his approach, he fell, as you can see, he fell. Even when you said he changed the approach and put in a resume, he get less call when he put in his resume like he is blind, than when he didn't put it. You understand? But he didn't get discouraged. Now, all these two said, we still have a lot to do, you know, because we still have a lot to do. Not only like you see what we are doing now, because even in the medical field, because how many people you see that completely blind, you see that go for nursing, or even they go for nursing. You know, some of the hospital may think they cannot do the job. You know, you may see a lot of them choose to do social worker because it's more sit down, talk, and do stuff like that. And even when you go to see the doctor, even some of the nurses, a lot of them are not even educated to even know. The person can fill out their own paper. Now, what we are trying to do is make sure everyone know, you know, and when we talk about equality, everyone is the same, everyone is equal, the person has just one disability, you have to have accessibility. Now, if you take all patients, you take someone that's completely blind, or someone that lost of vision, or someone that low vision, if you have some application, you have application in both language, in all. When I said all language, you have to have large print application. It would be best to have large print application. You would better to have even well application that can allow everyone. But we still have a lot to do, because right now you see it's only some of the restaurants, and some of them, I will not say all the restaurants, some of them, if you ask them for a menu, they have large print. Some of them, that may have some real meaning, but not all of them. We still have a long way to go. Because this is the reason I'm talking this thing. Because something that really bothered me is when one of my patients is come. Unfortunately, she passed away now. One of the first patients when I went open the Point Center, I know she used to get served by so many other agencies, but she was explaining to me. She said to me, "What bothered me is I like to go out with my husband. I used to like to go to the restaurant, and now when I go with him, I feel like I don't want to embarrass him." Because with the restaurant, I have my privacy. They have to ask me. I cannot. They don't even have what they have for me to even try to feel it, to see what I want. I have to. He has to ask me. I have to talk loud for everybody to know what I'm saying. You can see the frustration inside. It should not be the case, because in the way we live in, the accessibility. When we said service is accessible for everyone, it should be everywhere. That's why I'm saying to you, we still have a lot to go, because in the case of Adam, and he was able to find a job, but when he get the job, he get it to his classmate, one of his classmates that was able to.
Yes, it's because one of his classmates was actually the employer, and they went to school together, and the fact that they had that connection, his classmate gave him a chance to show that he could deliver, that he could do the job. And he actually spent close to 10 years, if not more than 10 years, of successfully working in that economic firm.
Yeah. And even what I see, even some of because we still have a lot to do. And as we said, because a lot of people who watch the show, a lot of people who lost the vision or vision impaired, as you start doing, you can do whatever you want. You have to go for the higher position. Sometimes what I see in a lot of state agency, a lot of place, even they serve people that blind or that low vision. People that lost the vision, it look like these people is just a facade. They just put them or just answer the phone. You understand?
Okay.
This is the type of job they give them. But can they do better? Of course they can do better. Can they help them to do better? If we are serving, this is where we have to be. Because I've been to the field. I've been to a lot of places. And I see, but I would say there is a lot of improvement that's happened, but still have more to be done. Because when you see when someone lost the vision, they still can have a successful life. It's just not like you just give things. Well, I'm giving them a little bit of thing. Well, anyway, they cannot do anything anyway. It's not true. You understand? You imagine this year I see like 2 OBGYN doctors that have diabetic, and they don't have that much vision, but they have a little bit. And one of them said to me, "I have to do surgery. I have to do this. I have to do this." You can see the guy start getting deteriorated. But you understand? When he has his vision before, and the vision is start getting, I don't say, and surgery is a different thing, getting inside someone's body, if you don't have vision. You understand? Unless, with the technology, with the laser thing, those robots do everything, stuff like that. I may understand that part. But these people, the best thing we can is educate them. What you have left as for your vision, that allow you to do stuff. You can still be in the medical field. You may not be able to do surgery, but you can still be part of the process. You understand? But the best thing you have to do, is control your blood sugar. Make sure you get it together. Because don't forget yourself. A lot of people in the medical field, they always forget themselves. They providing help, they forget themselves. You see, I'm go in and out as we in that part in the Adam situation. But all this to say, we still have a lot to do, because this discrimination still exists.
Well, that's also one of the motivating factors why Mr. Kirk Adams, even though he was a successful and economics, firm member, he said, he couldn't be satisfied with that. And he felt like he wanted to start something to help blind people. And so that's why he started the Foundation for the Blind, American Foundation for the Blind. And so those that need help, they need resources, reach out to these different agencies, reach out to these different foundations. There is help for you, there is support for you, and there's empowerment for you, because a lot of things are possible. It is not the end for us, but it's the end for the show today. It is the end right now.
Okay,
so
well,
we're going to conclude the show.
Well, for conclusion, I'm going to say a lot of people that lost their vision, that doesn't know, there is a lot of benefit out there for you. Whether for you for your mail, whether for you to get a specific material, if you like to read, if you like to listen to music, stuff like that. There is a lot of services you can get for free that's available for you. The only thing you can do, you can call to the press center. We will give you the information where you can get this type of services, and we can guide you to the state agency that will be able to help you. We will guide you to the Commission for the Blind. We will guide you, everywhere that can help you if you will not be able to afford some form of services. There is a lot for you to do this month. We're going to talk about a lot, and always stay tuned. I will say to you, just like this show, like the network, share it with a lot of people that doesn't see it, and I guess that's it for me.
Yeah, we'll see you next time. Thank you so much for being with us, and good night.
Souple, mandez pour moi si c'est ici qui c'est PCVI 550 West Merrick Road, Valley Stream, New York 11581. Nous traitons.
Oui, nous café sans famille. Oui, nous café sans amis. Oui, nous café sans famille. Oui, nous café ça.
C'est glauque comme fait nager. Ou ka traiter?
Oui, nous café sans famille. Oui, nous café ça. Nous café ouais.
Cataracte fait m'baka ouais ou sou ka traiter?
Nous café ça.
Depuis cycle la prend m'ba ouais ménager comme si ou tout. Tension j'aime toujours à monter descendre.
Café ça.
Nous capables? Pas gros côté opération ouais. Qu'on y a là ou possède depuis vin la bon.
Oui, nous café
Reste
ça.
dans tout posé. La journée mouais. Depuis l'angélisme pas rien. Ou ka traiter?
Café ça. Nous café ouais.
Depuis au monde devant moi mosso pas un mosso.
Café ça.
Comme si tout bon nous ka traiter?
Nous café ouais.
Eh ben nous même ça nous est ici.
Nous café ça.
C'est vrai?
Nous café ouais.
Bon ça nous y est depuis m'vini là. Ma point?
Téléphone nan c'est 516 238 50.
Mauvais vent allait, le soleil nous virait. La rose du matin lui tournait. Si pour bon Dieu gardait, faut me t'arraler des pieds. Depuis jour elle il finit par attendre. Petite nous bien grandi, faut le rester au pays. Si tellement moins fleuri, si je tourne maïs. Si rachète toute fatra, dominant bel drap. Si manger tous les jours, gagne place pour l'amour. Haïti, pas mourir. Au pays, pas fini. te mettre la misère. Des jours que exploitaient bon chemin l'enfer. Si la vie fait me crédit, pas marcher tout nuit. Pas besoin de prendre bateau pour n'ayez qu'un rapport. Et mauvais vent aller vers l'espoir revirer. Il faut nous rassembler pour nous réconcilier. Liberté gagnant prix nous payer sans crédit. Tout le monde y au poilerie, la misère y a fini. Haïti, pas mourir. Au pays, pas fini. Haïti, pas mourir. Au pays, pas fini. The rainy days are gone, now the sun is shining. Together we can chase all the better way. The children will be smiling, the misery is ending. United we won't fall, love always conquers all. We'll never die. Oh, Haiti, never fall. My country will always survive. Darkness is gone. Haiti, pas mourir. Haiti.